So starting with today's session, this is the Anatomy MCQ part 5. Okay, this is the part 5 of NEET PG 2021, targeting NEET PG 2021. So let's start with the session. Before starting the session, I would like to give you the brief of Unacademy platform, myself Dr. Monalisa. Now, I also want to tell you about the Unacademy platform and the unlock code. So, mine unlock code and referral code is ANAT10. So, this code can be used by you for seeing the free sessions on the Unacademy, special free sessions on the Unacademy platform, and also for taking the subscription of Unacademy. You can get 10% discount by using this code. Now, before starting the session, I would like to give you the schedule of the month of 2021 for this. So, these are the sessions which I am taking up. Let's crack NEET PG 2021, that is 9 PM session. So, that is the 9 PM session. Yeah, Shahrukh Adam. Good evening Aditya Kumar, good evening Saruk Ahmed. Okay, so yes, this is the session which is the 7:30 PM session. Today is the 5th session of Let's Crack NEET PG 2021. Now, FMGE session is on the 9 PM session on the Unacademy platform. So, you can avail the opportunity to be the part of this session by using the code ANAT10, and conceptual anatomy session timing is 6 PM. Now, this is the schedule. Okay, let's crack NEET PG. Today is the 5th session. Altogether 15 session I am taking. This is the session of FMG session. Altogether 17 sessions I am taking, and the timing is 9 PM. Only on Saturdays and Sunday I take also the session in the afternoon, that is 1 PM session. And for conceptual anatomy session the timing is 6 PM. Total of 17 session for this month. Now, before starting the session, I would like to tell you about the merging of Prep Ladder and the Unacademy. So, this is the iconic subscription of Unacademy. You can use this code, that is the ANAT10. You can use the code ANAT10 for 10% discount. Also, you can boost your preparation by taking 3 months subscription and getting additional 1 month subscription absolutely free. Yeah, good evening dear everyone. So, just few seconds, also brief about the upcoming session, and then I can start with the MCQ session. Okay, so this is the MBBS foundation course for second batch, second year MBBS course. This is the foundation course for the third year batch. These are the targeting next 2022 batches. These are the upcoming sessions of for the image based revision session. So, any of this plus subscription you want to take, you can take on the Unacademy platform. Total 34,000 MCQs are there on the Unacademy platform. You can just download the app. Okay, you can just download the Unacademy app and then search for the goal NEET PG, and thereafter you can take the subscription of Unacademy. So, this is how you can be the part of Unacademy platform. Now, let's start with the first MCQ today's session. So, everyone waiting for it. Okay, so which of the following muscle produce intorsion of eye? So, this is the first MCQ. Okay, which of the following? So, I will give you another 30 seconds for marking it right. So, which of the following muscle produce intorsion of the eyeball? Whether it's option A, that is superior rectus and superior oblique, option B, that is inferior rectus and inferior oblique, option C, inferior rectus and superior oblique, option D, superior rectus and inferior oblique. So, whichever you seem is right, mark the answer. Your time begins now. Option A, B, C and D. Question number 1, mark the correct answer. Which of the following combination is causing intorsion of eyeball? So, yes, Saruk Ahmed has given the answer. Waiting for others. Okay, Kumaran is telling it's D. It's D. Okay. Superior rectus and inferior oblique. So mixed bundle of answers are coming up. Okay, let me explain this MCQ. Actually, the correct answer here is A. A is correct, that is superior rectus and superior oblique. Okay, so it is important that for cracking the examination, you should know the details of the muscles which is causing movements. Okay, you should know that detail. So actually, you can see here that the important actions which is performed is elevation. These are the sets of action: elevation and depression, medial and lateral movement, that is adduction and abduction, and also extorsion and intorsion, which is also called as external rotation and internal rotation. So this action occurs in 3 planes. Okay, these action occurs on 3 planes. Okay, so adduction, abduction across the vertical axis, it takes place across vertical axis. Superior and inferior, that is elevation and depression, occurs across horizontal axis, and around AP axis, that is antero-posterior axis, actually rotation. So when the eyeball is externally rotated, it is called as extorsion. When it is internally rotated along AP axis, it is called as intorsion. So actually, how you are going to remember this? Future doctor has given absolutely right answer. The answer was A1. Yeah. Now, yeah, why? Because you just can remember, actually oblique muscle always has got its action opposite to that of its name. Superior hai to inferior intorsion hoga. Okay, it will cause intorsion. So actually both the superior rectus and both the superior oblique, both superior one is causing intorsion. So I think you should revise the action of the muscle. So let me give you the details. How many extraocular muscles we have got? We have got voluntary 7 extraocular muscles. We have got voluntary 7 extraocular muscle. Okay. So yes, 7 extraocular muscles we have got. So see here, let's write the the action of the extraocular muscle. So write on extraocular muscles. Extraocular muscles. Okay, so extraocular muscles. So here the extraocular muscles are following. So we have got 7 extraocular muscles. So starting with the first, we have got medial rectus muscle, MR. I am writing short form. Medial rectus muscle, it is causing adduction of eyeball. It is causing adduction of eyeball. The lateral rectus muscle is causing abduction of eyeball. The superior oblique muscle is causing, so both the oblique muscle is action is just opposite to their name. So it is causing intorsion, depression and abduction. Okay, and inferior oblique muscle is causing extorsion, elevation and abduction. Okay. Now moving on to the next. So the superior rectus muscle is causing elevation, adduction and intorsion of eyeball. So I think you got the correct answer now. So we can see that superior rectus and also the superior oblique both are causing intorsion. Inferior rectus is causing depression, adduction and extorsion of the eyeball. LPS, what do you mean by LPS? Levator palpebral superioris. Levator palpebral superioris. It is causing elevation of eyelid. It is causing elevation of upper eyelid. So done with this. So now I think so everyone is okay with the answer. So is it okay? Can we move on to the second MCQ? Let's move on to the second MCQ now. Okay. So second MCQ. Which muscle assists in extension of forearm, resist abduction of ulna during pronation of forearm, and tenses the capsule of elbow joint so that it is not pinched when the joint is extended? Which muscle assists in extension of forearm, resist abduction of ulna during pronation of forearm, and tenses the capsule of elbow joint so that it is not pinched when the joint is extended? Options are A. Anconeus, B. Triceps brachii, C. Coracobrachialis, and D is brachialis. Okay, D is brachialis. So yes, question number 2, mark the correct answer, everyone. Then I will give you the answer. So 2 is which muscle assists in extension of forearm, resist abduction of ulna during pronation of forearm, and tenses the capsule of elbow? These are the key points. So you have to give the answer. So yeah, triceps brachii, students are telling it's triceps brachii. Okay. 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 So let me come up with the explanation. Kumaran is telling A. Okay, Kumaran is telling it's A. Okay. So yes, the correct answer is Anconeus. The correct answer is A, that is Anconeus. The key point here is it is a muscle which is assisting in extension and tensioning the elbow joint. Also resist abduction during pronation. So all these actions which is mentioned in this MCQ is pointing toward which muscle? Anconeus muscle. Anconeus muscle is tensioning the capsule of elbow joint. Okay. So that is the reason this is the Anconeus is the correct answer. So here you can see here Anconeus muscle originating from the lateral epicondyle. As you can see here, this bony prominence is lateral epicondyle. This bony prominence is lateral epicondyle of the humerus bone. So from here it is originating and it is inserting into the lateral side of olecranon process. It is inserting into the lateral side of olecranon process. Action is, it is extension of elbow. Actually it is not a proper, it is assisting, it's a weak extensor of elbow joint. It's a weak extensor of elbow joint. Okay, so let's move on to the next MCQ, that is MCQ number 3. So this was direct MCQ. So everyone, can we move on to the third MCQ today? Third MCQ. Moving to the third MCQ. Okay. So triangle of Koch is bounded by all except, 4 options are there. It is bounded by all except A. Coronary sinus, B. Tendon of Todaro, C. Septal leaflet of tricuspid wall, and D. Superior vena cava opening. So mark your answer. So everyone, Shweta, Kumaran, Shahrukh Ahmed, Future Dog. B, okay, is bounded by all except triangle of Koch is not bounded by which of the following structure. So 3B, tendon of Todaro. Shavita is also telling it's B, tendon of Todaro. Okay, what about rest? It's D. Okay, so Shahrukh Ahmed is telling it's D, superior vena cava opening. Okay, Kumaran is telling it's A. Future Doc is telling F. F is not there, only 4 options are there. Amol Mystery B. Okay, so mixed bundle of answers are coming up. So let me tell you about the correct answer. The correct answer, triangle of Koch. Okay, B. So Vishnu is telling B. Saruk is telling where. Okay, so you want the explanation. So coming to the explanation, triangle of Koch is bounded by all except, so D. Shweta is telling D. So D is the correct answer. Absolutely right. So yes, D is the correct answer. D is correct answer. Superior vena cava is not forming its triangle of Koch boundary. So D is the correct answer. I will explain you where is the triangle of Koch located. So it is located in the interior of, okay, when you see the interior of right atrium, so let me just explain you here. When you see the interior, okay, so when we see the interior of right atrium, there we see the triangle of Koch, and this triangular area which is bounded is the triangle of Koch, which is seen in the interior of right atrium. It's a very important anatomical landmark because here lies the location of AV node. So here lies the location of AV node. Here lies the location of AV node. Okay. So if you talk about its boundaries, it is bounded by 3 structures as shown here. So tendon of Todaro, superiorly it is bounded by tendon of Todaro. Superiorly it is bounded by tendon of Todaro. Okay. Tricuspid valve leaflet. So actually tricuspid valve leaflet, this is forming its boundary. This is forming its boundary anteriorly. And coronary sinus. So coronary sinus, it is this coronary sinus opening. So opening of coronary sinus is forming its boundary postero-inferiorly. Postero-inferiorly. Here you can see this is the opening. This is coronary sinus opening, which is opening into the right atrium interior. So in this diagram we can clearly see the boundaries of triangle of Koch, which is the location of AV node. So superior vena cava is not forming the boundary for this anatomical landmark. So I think it is clear to you, everyone. Everyone, is it okay? Triangle of Koch is bounded by tendon of Todaro, which is subendocardial thickening. What is tendon of Todaro? It is subendocardial thickening, which is lying on the superior, antero-superior aspect. Here lies antero-superior aspect tendon of Todaro. So tricuspid valve opening, septal valve anteriorly, and coronary sinus opening lies postero-inferiorly. So let's okay, got it. Now let's move on to the next MCQ, that is, everyone, let's move on to the next MCQ, that is MCQ number 4th. Okay, question number 4th. Pudendal canal is a space lying in deep perineal space, in superficial perineal space, in obturator fascia, in urogenital triangle. In urogenital triangle. Pudendal canal is a space which is lying in deep perineal space, superficial perineal space, obturator fascia, and urogenital triangle. So mark your answer, question number 4, all of you. So yes, waiting for answers. Mark the correct answer. So okay, Saruk Ahmed is telling it's C. Okay, obturator fascia. What about others? Fourth answer C, C, C. Okay, Kumaran, future doc C. Okay. So most of you are telling it's C. It's C. Most of you are telling it's C. Okay. Deoxydabin is telling it's Alcock's canal and it's obturator fascia is the right answer. Okay. So yes, let me explain. So I am coming up with the explanation. Actually, most of you, no, not most, all of you are right. The correct answer is C, that is obturator fascia. And yes, it's absolutely right. The other name of pudendal canal is, it is also called as Alcock's canal. The other name of pudendal canal is, it's also called as Alcock's canal. Absolutely right. Which Alcock's canal is absolutely right. It is also called as Alcock's canal. And actually the separation of obturator fascia is covering the obturator muscle which is obturator internus muscle. It is covered by obturator fascia. The splitting of obturator fascia leads to the formation of pudendal canal, and also the separation of obturator fascia and lunata fascia. So I will explain that. Let me come. So I would like to show you the pudendal canal here in the diagram. So here you can see this space which you are seeing, which I am highlighting here. This is the space of Alcock's canal or pudendal canal. This is the space of Alcock's canal or pudendal canal. Yes, Ames, Delhi, yes, absolutely right. So actually this fascicle canal, which is called as the pudendal canal, is located in where? It is located in the lateral wall of ischiorectal fossa. Ischiorectal fossa, approximately about 1 inch. 1 inch means 2.5 centimeters above the bony landmark. Can anybody tell me above which bony landmark it is located? Pudendal canal or Alcock's canal is located above which bony landmark? 1 inch or 2.5 centimeters above which bony landmark? Anyone? 2.5 centimeters above ischial tuberosity. Above ischial tuberosity. So above ischial tuberosity. And what is the extent of pudendal canal? So you can see it is extending from, this is what? This is lesser sciatic notch. So it is extending from lesser sciatic notch. It is extending from lesser sciatic notch till the level of this dotted line which I am showing, and this is the ischial tuberosity. Yes, Kumaran is absolutely right. This is the location of deep perineal pouch. Deep perineal pouch. So yes, it is extending from the lesser sciatic notch till the level of deep perineal pouch. So here I would like to write here the details about pudendal canal. So write on pudendal canal extends from lesser sciatic foramen to posterior limit of deep perineal pouch. Deep perineal pouch. Formation. So what is the formation? Formation is, it is formed by splitting of obturator fascia. It is formed by splitting of obturator fascia. One more point I want to elaborate here. It is just not the splitting of obturator fascia but also the separation of. The other reason of formation is separation of obturator fascia from fascia lunata. So it is also important that you should know what is fascia lunata. It's also important. that the knowledge of fascia lunata is known to you. And you can see here in the pudendal canal, the structures going is the pudendal nerve and its branches is given here, that is perineal and inferior rectal nerve. So, pudendal nerve, which nerve is traversing, which is formed by ventral rami of S2, S3 and S4. Pudendal nerve is traversing through pudendal canal. So, the next point which you have to know is that you should also know about fascia lunata. Okay, so what is fascia lunata? So, actually fascia lunata is the part of obturator fascia only. Fascia lunata is the part of obturator fascia only. Okay, so write down fascia lunata is actually part of obturator fascia. The next point which is important, that it is also should be known to you the exact location of fascia lunata. So, it forms the outer wall of ischiorectal fascia. Fascia lunata is forming outer wall of ischiorectal fascia. Ischiorectal fascia. Got it? And what does it encloses? So, it encloses pudendal nerves and vessels. It encloses pudendal nerves and vessels. It encloses pudendal nerves and vessels. Got it? So, yes, Praveen Shinha, well explained. Thank you. So, understood? Great. So, let us move on to the next MCQ now. I think it's well understood. So, let us move on to the next MCQ. All the best to everyone. Okay. So, yes. So, moving on to the next MCQ. Two median umbilical fold represents remnants of option A urachus, option B umbilical arteries, option C umbilical veins and option D is ductus venosus. Two umbilical fold represents remnants of A urachus, B umbilical arteries, C umbilical veins and D ductus venosus. So, mark your answer. Okay, two umbilical folds. Okay, Rakesh Sharma is telling D. Okay, two umbilical folds represent two medial umbilical folds. Two medial umbilical folds. Okay, Gautam D, Rakesh Sharma D. So, the point is B. Okay, B, who Shahrukh Ahmed is telling it's B. Yeah. So, waiting for others. Two medial umbilical fold. So, yes, take your time and mark the correct answer. So, I think I would come with the explanation. So, yes, arteries, deoxydabin is telling arteries. The correct answer here is umbilical arteries. So, those who have given B is absolutely right. Medial umbilical fold represents umbilical arteries. What it contains? It contains remnants of umbilical arteries. So, B option is correct. So, I would like to show you this diagram. So, let me first enlarge this and let me explain you. Okay. So, here actually folds, we can see important folds here and we should know what are the structures which is lying in this fold. Let me just highlight this diagram. So, there is one median fold. So, this is median fold. For example, you can see this median fold is merging with the apex of the urinary bladder. So, this fold is median fold. This is median umbilical fold. This is median umbilical fold. Okay, this is going towards apex of urinary bladder. This is going towards apex of urinary bladder. Just adjacent to it, we have got two other folds here. diverging here. So these two folds are medial umbilical fold. These are medial umbilical fold which is containing remnants of umbilical fold, which is containing remnants of umbilical arteries. Okay. And on the upper aspect, this fold which you are seeing, which I am highlighting with green color, this fold which you are seeing is the falciform ligament, which is here. This enclosing part is ligamentum teres. This is ligamentum teres. Okay, left umbilical vein. It contains remnants of left umbilical vein. And one more fold is lying here. If you go more laterally, this fold. So I am just highlighting here. On lateral aspect, the fold lies. And this fold, this lateral fold will contain inferior epigastric vessels. It will contain inferior epigastric vessels. So see here, we have got, when you see the anterior abdominal wall from posterior aspect, when you take out that wall and the posterior aspect of anterior abdominal wall, you can see following folds. You can see median umbilical fold, we can see two medial umbilical fold, you can see ligamentum teres fold, and you can see also the lateral umbilical fold that is containing inferior epigastric vessels. Okay. So thereafter, let's see this diagram. Here, this is the diagram. This is a cadaveric image in which we can, firstly I want you to show the fold, and this is the urinary. Actually median umbilical fold is, if we see the center one, this is going towards the apex. This is the apex of urinary bladder. So it is going towards the apex of urinary bladder. As you can see, it is going towards the apex of urinary bladder. On lateral to it, there will be two other fold. What is these? These are medial and lateral umbilical fold, which is containing umbilical artery, and at lateral to it, we have got lateral umbilical fold, which is containing, these are lateral umbilical fold, and this lateral umbilical fold contains, this lateral umbilical fold will contain inferior epigastric vessels. So after seeing this diagram, I would like to give you the details also so that you can revise it, which I have told. So write down the folds and what it contains. So we have got ligamentum teres, inferior aspect of the falciform ligament, which is dividing the liver into anatomical right and the left lobe and getting attached to anterior abdominal wall. So ligament teres is containing remnants of left umbilical vein. It is containing remnant of left umbilical vein. The second one, that is, we have got two. So this is ligamentum teres is just one ligamentum teres fold is there. We have got two medial umbilical ligament and fold. This is containing remnant of umbilical arteries. It is containing remnant of umbilical arteries. The third one, that is median umbilical fold. Median umbilical fold or ligament is containing urachus, which is connecting the apex of urinary bladder to umbilicus, and it is containing remnant of allantois. The fourth, that is the lateral umbilical fold. Lateral umbilical folds, one on either side, two lateral umbilical folds are there, one median umbilical fold is there. This fold is containing inferior epigastric vessels. Inferior epigastric vessels. So done, everyone? Have you understood this? Moving on to the next MCQ. So let's move on to the next MCQ. Before that, I would like to show you one more diagram here. Okay, so one more diagram has been shown here. This is the anterior abdominal wall, posteriorly anterior abdominal wall we can see here. So here it is having lateral umbilical fold, lateral umbilical ligament. So here you can see there is medial, median and lateral umbilical ligament. Okay. So medial is this one which is going towards the urinary bladder. This whole area which you are seeing is the urinary bladder. This is the median which is containing urachus, and on either side of the median this is the medial which is the containing the umbilical artery, and lateral to it this fold which you are seeing here, this will be the lateral umbilical fold or ligament. So done. So same thing I have explained. I think now let's move on to the next MCQ. Okay, question number 6. So all of you, which structure forms superior boundary of Omental bursa? Which structure forms superior boundary of Omental bursa? Question number 6. Mark your answer. It's a direct MCQ. Whether it is inferior vena cava, whether it is duodenum, whether it is caudate lobe of the liver, whether it is hepatoduodenal ligament. Which structures form superior boundary of Omental foramen? Mark your answer. Four options are there: inferior vena cava, duodenum, caudate lobe of liver, hepatoduodenal ligament. So yes, fourth C, it's the sixth question, it's the sixth one. Which structure forms superior boundary of Omental bursa? Future doctor is telling it's caudate lobe of liver. Okay, Saruk is C, caudate lobe of the liver. Okay, so future doctor and Saruk, Shweta is also telling it's C, caudate lobe of the liver. Okay, Kumaran is also selling 6C. Okay, the correct answer is absolutely right. C is the correct answer. Okay, so this is a direct MCQ and we have to know the boundary of Omental bursa. So I would like to show you a diagram in which you can appreciate the boundaries. Okay, see this diagram. So yes, here we are seeing the boundaries of Omental bursa. Epiploic foramen. Okay, epiploic foramen, that is foramen of Winslow. So yes. Now here superiorly it is bounded by caudate process of liver, posteriorly by inferior vena cava, inferiorly by first part of duodenum, and anteriorly by the free margin of lesser omentum, which is containing hepatic artery, bile duct and portal vein. This is containing three structure. Okay, this is portal vein, this is hepatic artery and this is bile duct. So here bile duct will lie to the right hand side, hepatic artery and portal vein will lie posteriorly. So done. Let's move on to the next MCQ. Yeah. Which of the following is true statement regarding stylomastoid foramen? Which of the following statement is true regarding stylomastoid foramen? Whether it is A, localized between styloid process and mastoid process of sphenoid bone, Through it passes the cranial nerve fifth, sensory nerves of the face, or D, stylomastoid branch of posterior auricular artery traverses through it. So, according to you, which is the correct answer? Question number 7. Question number 7, which is the correct answer? Seven D. Okay, so I am getting Sham is telling it's D, Sam is telling it's D. Let's waiting for others. Shahrukh D, 360 D. Okay, 360 is also telling it's D. Kumaran is selling 7C. Future doctor is telling it's D. Okay. So yes, let me come up with the explanation of this MCQ. The correct answer is, Mayank Tyagi is telling C. The correct answer is D. Okay, the correct answer is D. Now, stylo, the first thing is that the first option which is given here about the location is absolutely wrong. Option A is not right, it's wrong. Why? Because it's not located between the styloid process and mastoid process of sphenoid, but the mastoid process of temporal bone, not the sphenoid bone. So, it is wrong. Fifth cranial nerve traverses through it is not right. So, fifth cranial nerve has got 5. It's the fifth cranial nerve is the trigeminal nerve. It is having ophthalmic division passing through superior orbital fissure, maxillary division passing through foramen rotundum, mandibular division passing through foramen ovale. So, this can't be the correct answer. Sensory nerves, actually sensory innervation of face is via trigeminal one. Whole of the face has got the 3 divisions of trigeminal nerve is giving sensory innervation to the face. So, it's not the correct answer. The correct answer is D. So, let me write the details and then I will show you the diagram. So, please write on. First thing is about its location. So, stylomastoid foramen. I would like to show you the diagram also. Stylomastoid foramen. It is located between styloid process and mastoid process of which bone? So, as I told you, it is located between styloid process of which bone? The answer is temporal bone, not the sphenoid bone which was given in the option. The bone is temporal bone. What structure passes through it? Structures traversing through it. The structures which is traversing through stylomastoid foramen is 7th cranial nerve, that is the facial nerve, and also the stylomastoid branch of posterior auricular artery. Posterior auricular artery. So, many of the students has given the right answer. So, these are the 2 structures which is traversing through it and its location is between the mastoid process and the temporal bone. Yes, Kumaran, you are absolutely right. Yes, most of you have written, yes, it's a temporal bone. Absolutely right. Now, let's see the image here. So, the arrow is marked at the opening. Can you see this opening? This opening is stylomastoid foramen. So, just enlarging it. Yeah. So, see here, this is the mastoid process which you are seeing. This is the mastoid process of temporal bone. Okay. And this arrow which is pointing here, this arrow is pointing to a foramen. What is this? This is stylomastoid foramen. This is stylomastoid foramen. Okay. So you can clearly see it is lying close to the mastoid process of temporal bone, and also styloid process is lying here. So in this bone it's slightly broken, the styloid process. I will show you one more diagram for it. See here. Okay, so let me, yeah, got it? Yes. So here you can see the stylomastoid foramen. This is the location of mastoid process. This is the mastoid process, no doubt. This elongated process is the styloid process. So now you can clearly see the blue color structure is just making you highlight here. This structure which is shown here is the facial nerve, and you can see it is passing through this foramen, and this is the stylomastoid foramen. Now it is absolutely seen to you, its exact location is between styloid process and mastoid process of temporal bone. Is it okay? Okay, future doctor first year ki yaad aa gayi, very nice. Okay, good. So let's move on to the next one. Okay, let's move on to the next MCQ. Is it okay? Let's move on to the question number. So this was which question number? This was 7th. Let's move on to the 8th number question. All are lateral rotators of thigh except, all are lateral rotators of thigh except A. Quadratus femoris, B. Obturator internus, C. Obturator externus, D. Gluteus medius, and E. Inferior gemellus. So according to you, which is the correct answer? Question number 8. Direct MCQ, just the action has been asked. So yes, I am getting Akshit Bhatia is telling it's D. 360 degree is telling it's D. Okay. What about others? Saruk Ahmed is telling it's D. Gluteus medius, medial rotator along with gluteus minimus. So, okay. Okay, so Akshit Bhatia has given the explanation also. Very nice. Sam is telling it's 8th one D. Yeah, so all of you are absolutely right. It's gluteus medius. Actually, gluteus medius and minimus are internal rotators of thigh and abductors of the hip. Now, lateral rotators of the thigh, when we talk about lateral rotators, all the muscles which is lying below the gluteus maximus muscle under the cover, they are all lateral rotators of thigh. So, quadratus femoris, obturator internus, both superior inferior gemelli, obturator externus, all these muscles will be lateral rotators. All these are lateral rotators. If we talk about gluteus medius along with minimus, they are medial rotators and abductors of thigh. So, gluteus medius and minimus. Ma'am, after yes, 360 degree you have missed. Yes, it will be there. You can see. Yes, it will be. All the questions will be there. You have to just see the video once more. So you can just quickly see the MCQs also. You can fast forward it and then see. Gluteus medius and minimus are abductors of hip and internal rotators, or you can say medial rotators of hip. Sure, 360 you can see. And yes, after FMG, so 9 PM is again my FMG session. You can join me there. Yeah, so done. Now let's move on to the 9th MCQ. Which is not a branch of facial artery? 5 options are there. A. Inferior labile artery, B. Superior labile artery, C. Lateral nasal artery, D. Angular artery. E. Retromandibular artery. Akshit Bhatia, what is Trendelenburg sign? Yeah. Now what happens? Yes, that's a good question. Trendelenburg sign. So Bhatia has asked. Akshit Bhatta. Okay. Trendelenburg sign. What happens in case of injury to superior gluteal nerve? What is the nerve supply of gluteus medius and minimus? It is superior gluteal nerve. So that what happens, this gluteus muscles is paralyzed. Actually, when you stand on one leg, okay, when you stand on one leg, so the other side of the leg is slightly raised and it is supported by the gluteus medius and minimus of the other side. If there is injury or paralysis of gluteus medius and minimus, the other side of the hip can't be supported by the gluteus medius and minimus of the other side. Because of this, if the paralysis of this group of muscle is lying, there will be sagging down of the hip. Generally, if you stand on one leg, then there is slightly the hip is raised on the other side. So there will be sagging down of the hip and this is called as Trendelenburg sign. Is it okay? Akshit, have you understood? It occurs due to injury to superior gluteal nerve and muscles paralyzed as gluteus medius and minimus. So yes, and there is one Trendelenburg sign also and test also that is done for great saphenous vein, that is in the case of incompetency of valves also. So yes, I am getting answers. Future doc is telling E, okay. Kumaran E. So let's wait for the others. Akshit, is it okay? Have you understood? Okay, 360 degree is also telling E. Which is not a branch of facial artery. So yes, the correct answer is E, that is okay, great Akshit. Okay, the correct answer is E, that is retromandibular artery. All other arteries which is mentioned here, is the branch from the facial artery. It's exactly the branch from the facial artery except retromandibular artery. Okay. So yes, for this MCQ, I would like to describe in brief about the facial artery. I would like to brief you about the facial artery, its course and its branches. Now everyone must be knowing facial artery is a branch of which artery? Facial artery is a branch of which artery? Everyone? So here let me just slightly enlarge this diagram. Okay. So facial artery, as you can see here, this is external carotid artery. So facial artery, this is the facial artery which is shown. This is the facial artery and facial artery is a branch of external carotid artery. Yes, absolutely right Akshit. Absolutely right. Okay. So let me just slightly enlarge it. Okay. So you can see here the facial artery branches has been shown. This is one going towards the upper lip, superior labile. The one branch going towards the lower lip, that is inferior labile. And its branch is going in upward direction here, that is towards the nose, lateral nasal and angular. Okay. So these are the branches, as you can see, these are the branches of facial artery. So I would also like to give you just brief in points, not much detail, brief points about the course of facial artery. So please write down course of facial artery. Okay. So first point is that facial artery, branch of external carotid artery. Now which branch? Anterior branch of external carotid artery. It's an anterior branch of external carotid artery. Facial artery is anterior branch of external carotid artery. Now about the facial artery course, about the course of facial artery, write down facial artery is given in which triangular area? It arises in carotid triangle. It is given in which triangular area? In the carotid triangle. So this is the first point about it, or the first course, it is arising in carotid triangle. So I am just giving in very brief and important points which has to be known by you. The second point is that it passes, thereafter it passes obliquely up beneath the digastric muscle, beneath the digastric and that of stylohyoid muscle. Okay. Thereafter, the third point, arches to enter a groove. So it is arching over a groove and then it is entering towards the posterior surface of a gland. Which gland? SMG. What is SMG? Submandibular gland. Submandibular gland. Yes, Kumaran, absolutely right. Tortuous artery, absolutely right. Now moving subsequently with the course. So fourth point about the course is, curves, thereafter it curves upwards over the body of mandible. So where at the mandible? Over the body of mandible, at the antero-inferior angle in relation to the masseter muscle, it lies antero-inferior. So at the antero-inferior angle of which muscle? Masseter muscle. Masseter muscle. Got it? The fifth point about the course, thereafter it passes upwards, arches over the cheek. So thereafter it passes forward and upward. It is coursing forward and upwards across the cheeks and it will reach towards the angle of mouth, giving a superior and inferior labile, and also arches over side of nose. About side of nose. Got it? About the side of nose. Got it? Now what is the ending point? Where does it end? So it ends by becoming which artery? So it ends at the medial aspect of eye. It ends at the medial aspect of eye, becoming which artery? It becomes angular artery. It ends by becoming angular artery. It ends by becoming which artery? It ends by becoming angular artery. It ends by becoming angular artery. So yes, branches. Okay, who is okay? Saruk Ahmed, how many branches? Branches are superior. It is giving direct branches from the facial artery are superior labile, inferior labile. We have got lateral nasal and ending as becoming angular artery. Okay, superior, inferior labile, lateral nasal and ending as become what does it ends by becoming angular artery. Okay, so I will show you this diagram also. It will be clear to you. Okay. So done. Now just focus on this diagram. Yeah. So here you can see the important branches. So okay, now coming to this. So you can see the branches. So you can see here the branches are superior labile, inferior labile. Here you can see superior and branches. Yes, Kumaran, absolutely right, Kumaran. So you can see superior, inferior labile going towards the nose, becoming lateral nasal and ending as becoming angular artery. Okay. Yes, one is it also gives branch, that is tonsillar branch from the facial artery, and it gives other branches to that of, this is subsequent branches which is going. Okay. So that is from the cervical aspect on the face. Okay, that is on the cervical aspect. So we are talking about the branches on the face. Got it? Got it, future doctors? Other branches you can see it also give branches towards the palatine, tonsillar branches, submental branches, glandular branches from the cervical part. Okay, in the MCQ it was talking about the facial branches only. Okay, got it? So all the important branches here shown from the facial artery. Is it okay? Can we move on to the next? Glandular branches is also given to the gland, submandibular gland, mental branches, tonsillar branches, palatine branches, ascending palatine. Yes, let's move on to the next question, next MCQ. Okay, so let's mark the next MCQ. Okay, which of the following taste sensation is correctly paired with its tongue region? Which of the taste sensation is correctly paired with the, so 5 options are there, you have to mark the correct answer. Which of the following taste sensation is correctly paired with the tongue region? A, sourness on the posterior part, sour taste, sweetness on the posterior part, saltiness on the lateral, salt taste, bitter at the apex, and sour taste onto the apex. Got it? Tenth number, mark the correct answer. Saruk Ahmed is telling B. Saruk Ahmed is telling B is the correct answer. Okay, let's see. Let's wait for the others to reply. Sam is telling it's A, sour taste. Okay, Sam is telling A, Shweta is telling B, waiting for others, then I will come up with the explanation. Okay, so let me explain. Is it okay? I will only explain. The correct answer is salty taste. The correct answer is salty taste on the lateral margin. This is the correct option. All other options are absolutely wrong. So don't worry, I will revise your taste buds of the tongue. Is it okay? So I think we should come up with the explanation of taste buds, taste sensation which is felt onto the tongue in different area. So all other options are absolutely wrong. Only D option is correct. 10 is D. Okay, Kumaran has given right answer. K. Shweta is also given the right answer. Okay, now see here. Yeah. So when this is the areas of the tongue where you can feel the taste sensations. Okay. Now most posteriorly the taste sensation which is felt in the tongue, bitter taste sensation posteriorly. It is lying on the most posterior aspect. If you will see, sour and salty taste sensation is onto the lateral margin. It is onto the lateral margin of the tongue. Sweet is onto the apex or tip of the tongue. It is on the tip or apex part of the tongue. Sweet taste sensation. Now, can anybody tell me the fifth taste sensation name? Fifth taste sensation name. Fifth one. Can anybody tell me the fifth taste sensation? So, now we have just seen that we have got following taste sensations. One is the sweet taste sensation is onto the tip of tongue. Salt on the lateral margin of tongue. Sour is onto the posterolateral margin, posterolateral aspect of the tongue. Bitter is posterior most part of the tongue. Bitter is posterior most part of tongue. Okay. So now I am talking, these are the 4 taste sensation. Can anybody tell me the 5th taste sensation? Can anybody tell me the 5th taste sensation? 5th one. Spice, no, I want the name of that 5th taste sensation. Anybody? Just give it a try. 5th. What is a particular name is given for that taste sensation? Anyone? The 5th taste sensation. That taste sensation is called as spice, ma'am. No, umami. It is umami. Okay. What is this sensation? This is found in Chinese food and this is the taste sensation of Ajinomoto. This is Ajinomoto taste sensation which is found in, which is added in the Chinese foods. This is the taste sensation of which substance? MSG. What is MSG? Monosodium glutamate. Yes, Shahrukh. Monosodium glutamate. Monosodium glutamate. So actually not a particular area is defined for this. This is the 5th taste sensation. So particular area is not given to these taste sensation. It is over the whole aspect of the tongue. So it is distributed over whole area of the tongue. Whole area of the tongue, this umami taste sensation is distributed, not exactly uniform area is still, whole of the tongue, diffused area of the tongue. And this is the taste sensation for Ajinomoto monosodium glutamate. So yes, we have done the 10 MCQ of today's session. Now before ending the session, I would like to give the brief of the upcoming sessions, and for unlocking the Unacademy free sessions on the special classes which take place on the Unacademy platform, you can use the code, referral code ANAT10 or unlock code ANAT10. Okay. Now the schedule for this month session is again 7:30 PM is the timing for Let's Crack NEET PG 2021 session. Okay, so tomorrow will be the 6th session. FMG session just now 9 PM I am starting on the Unacademy platform. Here again 10 MCQs I will discuss. 9 PM is the timing. Those who want to attend, they can just download the app of Unacademy. They can use the unlock code ANAT10 for seeing my sessions. 6 PM session is for those who are going to appear for next examination 2022-23 and also for the first year MBBS. This is 6 PM timing. Okay, I included today itself. Okay, yeah, Kumaran study, last 2 questions I have included in the today itself only. Okay, don't worry, we will go on. Sometimes if we go in more depth, 1 or 2 questions remain, so I will conclude it in the next day. Okay, Kumaran. So now coming to the details of the session. So tomorrow will be the 6th session of YouTube session of NEET PG 2021, timing 7:30. Study 2 MCQs 360 Kumaran. Yes, I know 2 MCQs of study. I mixed that MCQ with the today's session. Okay, so it's a total of 10. So tomorrow study session is mixed with this session only. Don't worry, anytime I will come up with 2 more MCQs. Okay, Shweta Kumaran, I will add on 2 in any day. Okay, don't worry. And Let's Crack FMG session is the 9 PM session. Unlock code ANAT10 on the Unacademy special sessions. Total of 19 to 21 sessions I will take. Okay, so it will be useful for you. You can join me this for this session also. And conceptual anatomy sessions, again this will be a 6 PM session. Those who want to study anatomy from the basics, they can join me. A total of 17 sessions. 6 PM is the timing. Okay, so all the best to everyone. We will meet tomorrow with the upcoming session of the NEET PG. Let's Crack NEET PG 2021. All the best. Keep studying. Thank you so much. Okay, so I am ending the session. Thank you. We will meet tomorrow at the same time. Thank you.